Welcome to the Barrier Breakdown, Disrupting Mental Health podcast, where we talk about the clinical and practical issues that face those working in the mental health industry.
Hello, everyone, and thank you for joining us with this week's episode of the Barrier Breakdown, Disrupting Mental Health. My name is Erin Molyneux-Bailey. I'm the Chief Operating Officer at Cognitive Behavior Institute, and my co-host, Dr. Kevin Caridad, who is the CEO and owner at Cognitive Behavior Institute. This week, we are joined by clinical psychologist, Dr. Jason Goodson, who has over 10 years of experience, not just providing evidence-based care to patients with conditions like depression, anxiety, and PTSD, but also in training other mental health professionals in evidence-based interventions. Dr. Goodson is the creator of behavior therapy for anxiety-related disorders, which draws on his experience and research on anxiety-related conditions. So thank you so much for being here with us today, Dr. Goodson. Can you share with our listeners a little bit about how you became interested in mental health, as well as specifically evidence-based treatments?
Oh, sure. I'd love to. I think I actually became interested in psychology or mental health from a fairly early age. In fact, I think it was in high school, and I say that because I found my aptitude testing, and I had included in a section that I wanted to be or go into psychology. And I didn't waver much from that path. I got into college, and I declared a psychology major pretty early. Then I knew I would need to go to grad school, so I started kind of working in related fields and trying to get a little bit of research experience. And after I graduated, I started applying to programs, and I got very lucky to get into Utah State's program. And I say that because shortly after applying, I got a rejection letter. And then kind of just for good measure, I guess, they sent me another one a week later. And then a couple months later, someone called me and they said, well, there had been a mistake and you were going to be an alternate, but now we have a position, which I don't believe, but I wasn't about to argue. I was thrilled to be a part of to get into that program, and I'm still grateful. It was a good learning or a good training program.
Wonderful. And tell us a little bit about how you specifically, as you began to practice mental health and study mental health, how you became interested in evidence-based treatment.
Yeah, so I think anxiety treatment and evidence-based treatment kind of go hand in hand. And my primary clinical and research interests were always in anxiety and related disorders. And that wasn't a great fit at Utah State. So the first chance I really got to specialize in the area was in my postdoc. And again, I got very lucky. I got accepted to a postdoc through Dartmouth, specialized in evidence-based treatments, primarily exposure for anxiety-related disorders. And that time, that included PTSD and OCD as well. And my mentor, Dr. Claudia Zafert, I learned an incredible amount from her. And it was during those 2 years that I really got immersed in delivering evidence-based treatments for anxiety and trauma, and also doing a little bit of research. And I think, my career since then has been very similar. I took a job at the VA, and I got involved because of my experience with exposure. I got involved in the Prolonged Exposure Initiative, and I became a consultant and a trainer. And I assumed a role of evidence-based coordinator at one of my facilities. And I also moonlight at the Center for Anxiety and Behavior Therapy. And I continue to kind of try to squeak out a little bit of research when I can. So it's really kind of been how my career has gone.
Okay, great. One of the things, my dissertation, when I went and did it, looked at evidence-based practice, how it's taught in grad school and utilized afterwards, which is not strong. And my background prior to was nursing. I was a registered nurse, and it's interesting because we call it evidence-based practice. When we're in the hospital, it wasn't like, hey, are you using evidence-based practice medication? It's like assumed. Can you talk a little bit about why we're, at least from your perspective, why we list things as evidence-based practice and some of the dynamics in behavioral health? Because I'm sure some of the listeners are going to view this with different lenses, evidence-based practice, exposures, because I know people have different experiences. What can you add to that conversation?
So I think that actually really is a great question and a very important one. And as you were kind of saying, like our field has not traditionally espoused kind of evidence-based treatments, and there are a lot of kind of different camps in our field. Now, I guess I will say that kind of good therapy is good therapy, right? So if you look at like therapy done in other camps, the therapies that are good actually look quite similar. But I do think that one of the kind of major differences is that kind of there is the research base behind evidence-based treatment to support and know that it's effective. And I think in today's world that's just becoming more and more important. And otherwise, it can be hard to know what you're doing is effective. And what we're particularly bad at is knowing or catching when things are not going well or people are getting worse. And so I think that there are there's probably multifactorial why there's been kind of more of an emphasis on it. But like from my own standpoint, doing something that is rooted in evidence or has evidence makes me feel a lot more confident in what I'm administering.
Okay, great.
I hope I answered that question.
No, that was great.
Yeah, you certainly did. Can you tell us a little bit about what exactly is behavioral therapy for anxiety-related disorders?
Yes, I would love to. So behavioral therapy for anxiety-related disorders, or BTAD, is a very simple behavioral-based therapy that is rooted in learning or learning principles. And it focuses on countering the behaviors that maintain anxiety and trauma. Now, we refer to those behaviors as safety behaviors, and we can talk a lot more about what those are later. But in BTAD, this is done in two ways. There's two kind of primary interventions. The first is reducing or eliminating safety behaviors, and the second is countering safety behaviors. So, for instance, an example of eliminating safety behaviors would be fading the number of times a person checks the lock on the door. And this allows for a person to learn that it's not necessary to check more than once. And now, example of a countering intervention would be actually perhaps like leaving the door ajar or leaving it unlocked for a period of time. And this hopefully allows for learning that a break-in or something along those lines is much less likely than it feels, especially when you're anxious, right? Because when you're anxious, the things that we are anxious about feel much more likely. That's what anxiety does to our thinking, or how we think. So another example would be purposefully not ending a conversation early, while countering would be kind of purposely prolonging a conversation, or even kind of continuing to talk to a person after they maybe have been given cues that they need to leave. And I think this allows for learning that you can kind of put a person out a bit and it's not going to result in a serious negative judgment. Now, BTAD has, so one thing that I would like to say is it's kind of emphasis, or it's there's a heavy emphasis on learning, and so all exercises are processed from the standpoint of what was learned. Now, there are also two standard interventions in VTAD, and one of them is optional but recommended. The first is welcoming anxiety. Now, this is a mindfulness-based intervention that counters suppression-related safety behaviors. So my belief is that it's almost impossible to get over anxiety if we are trying not to have it, right? The more that we resist anything, but anxiety in particular, the more that it persists, the more it sticks around. So this is a core intervention that's emphasized throughout all of treatment, and it's kind of like purposefully practiced. It's practiced in the moment, and it's practiced when the exercises are being carried out. So in that way, there's kind of a mindfulness infusion in the treatment. Now, the second intervention is attention training. So safety behaviors such as worry, vigilance, monitoring, they are central maintaining factors in anxiety and trauma. And they maintain anxiety and trauma because they result in an over-processing of cues of threat. Now, the problem isn't that we enter into these states. The problem is that it's difficult to disengage from these states. So attention training is designed to enhance intentional flexibility so that we can switch attention from something that's threatening to something that's non-threatening. And that often would be present moment awareness. Attention training was developed in metacognitive therapy, and it has a lot of good evidence in reducing attentional safety behaviors.
Makes a lot of sense. A lot of clients that we get that have anxiety, they kind of get that intractable stuck kind of, deer in the headlights, and it's really hard for them to see anything beyond that. And it sounds like the methods of treatment that you're describing is really getting people to learn is that you can look away from the deer. It's not just going to stay in front of your car. It's going to likely to keep running across the road.
That's a great analogy. Yeah, I like that.
Okay, great. And can you tell us a little bit about your training that's coming up, and kind of what people can expect out of the training, and then, how ready are they to go afterwards?
Sure. So the training is a one-day training, and they will get a client manual and a therapist manual. So they should have all the materials that they need to implement the training. And I will offer consultation after if they want to have a session or two of consultation. But what we'll do is we'll go over the theory of safety behaviors. And then we'll kind of go over, like, session by session how to implement this, right? So the early phase of treatment, like the main goal through education and monitoring is to come up with like a master list of safety behaviors. And that becomes like the primary treatment document. And then you start to apply these principles or these interventions on this master list. And so we go through all the different sessions. And then for each type of safety behavior, I've written like a separate module. So for like to give some more information and some more examples of how to work with it and things like that. And I think we usually do some kind of experiential practices, like with welcoming anxiety, and sometimes with attention training. That gets hard virtually because sometimes it's hard to hear really well. But we usually at least will do the welcoming anxiety to get some practice doing that. And then the final session of treatment is a wrap-up session where we kind of the patient is asked to kind of write about their progress and what they still need to do to move forward. And yeah, we try to get like as much kind of participation as possible. And I guess another thing that's kind of emphasized is figuring out a way to practice these things in session, right? I feel like that's important. So it's not all just done as homework. But I guess generally speaking, the first part is educational, going over the theory, and then the last part is all application.
Okay, great.
Sounds very interesting. Some of our listeners who may be interested, can you share a little bit about what kinds of patients are appropriate for
Yes.
this type of training? I think that would probably help people hone in on whether some of their clients could benefit from this, and then they may be interested in attending on July 16th.
Yeah. So one of the great strengths of this treatment is that it is transdiagnostic. And so any person, any client with an anxiety disorder or a trauma disorder is going to be appropriate. I guess the one thing that I've noticed in my clinical experience that's a little bit that's caused some difficulties are when clients are becoming angry during the exercises. And I think that happens because there are a lot of positive beliefs about the safety behaviors we're working on. So that would be kind of the one thing that I've really noticed kind of consistently where it's not as good a fit. But I think that's one of the great advantages of this treatment. It truly is transdiagnostic. It can be used with just about anyone who has anxiety and trauma.
Wonderful. Well, like we had mentioned before, the training will be held on July 16th from 8:30 a.m. to 4:30 p.m. Eastern Standard Time with Dr. Jason Goodson here, who is the creator of behavioral therapy for anxiety-related disorders, the treatment. And anyone who is interested in attending can register on our website, which is www.cbicenterforeducation.com. The event is only $10 to attend virtually, so it is extremely well priced, so that we hope that lots of clinicians can benefit from this type of training that we are disseminating. So thank you so much for being with us here today, Dr. Jason, and we appreciate the time and look forward to speaking to you again in the future as you continue your research and all of the great things that you're doing in behavioral health.
Oh, thank you. It's been a real pleasure to be here. Thank you so much.
Wonderful. And thanks so much to our listeners for tuning into this week's episode of The Barrier Breakdown. We'll see you next time, and we hope you stay safe and healthy. Take care.
Thank you for listening to The Barrier Breakdown, Disrupting Mental Health. Listeners can find all of our episodes on YouTube, Apple Podcasts, Spotify, and Podbean. For more information and to learn about upcoming continuing education events, check out our website, cbicenterforeducation.com, our Facebook pages, Cognitive Behavior Institute and CBI Center for Education, as well as our Instagram at Cognitive Behavior Institute and our Twitter at CBI_Pittsburgh. Don't forget to like, comment, and subscribe. We hope you'll tune in for another guest next week.